Good afternoon. It's Wednesday, October 7th. I'm Mayor Jim Langfelder, Mayor of the City of Springfield, Illinois. We appreciate you joining us for this Facebook Live, and we have a great panel discussion with our leaders and our healthcare providers. We actually have each of our great institutions represented with regards to St. John's HSHS, Memorial Health Services, SIU Medicine, and Springfield Clinic, and I'll introduce them, but a few announcements or follow-ups. First is with regards to our last Facebook Live, it was with regards to the homeless, and we do have an update. We are working towards a larger winter warming center with the Salvation Army as a potential manager of that facility, working with the Continuum of Care and Josh Sabo. We really appreciate their efforts. We're right now with the street homeless, that's what we're trying to take care of. We're working on assessments for the individuals on the street, find out what their situation is. And it doesn't matter if it's someone that the government's trying to serve, or if you're in a business trying to serve your customer or a patient in healthcare. Our people on the streets is the same way. We need to find out what their situation is, how best can we help them to improve their supportive housing situation or their health situation. And that's what we intend to do. And we hope to have the Winter Warming Center open November 1st. And then for the next 3 months or whatever we have, improve their assessment with regards to that. The other announcement is, being October, trick-or-treating is around the corner. It's one of my favorite holidays. And with regards to that, we have communicated and partnered with our villages within Springfield, and that's Jerome, Grandview, Leland Grove, and Southern View. And we're all following the same parameters with regards to trick-or-treating. There will be trick-or-treating on Saturday, October 31st. It'll be from 4 to 8 o'clock. And we ask people to follow the COVID guidelines from the Illinois Department of Public Health. And there's information on our website, or will be, at springfield.il.us. But a broad overview of that is that we ask people that are wanting to give out treats, if you would put a table up in your property or 6 feet from the door. We don't want any bell ringing or doorbell ringing, just so we can eliminate personal contact. And then set the treats distant apart, where a trick-or-treater can just come up to the table and grab the treat and go. And for trick-or-treaters, we're asking that you trick-or-treat with your family members, and still observe the mask wearing, not just the costume mask, but a face covering. If you have not done so, cover it the right way over your nose and mouth. And then also carry hand sanitizer and keep moving. Really the key component is social distancing and making sure that we don't congregate, and that will help eliminate, or I guess reduce, the virus spread. And that's what's important. We want to stay in phase 4 where we're at. We want to move forward with regards to our, making sure we don't spread the virus any further, and make sure that we stay in the current phase that we're in through these winter months until a vaccine comes about, and then we'd be able to loosen the guidelines, so to speak, with regards to that. But I think for the duration of this year and next year, I think people should be getting used to social distancing, washing your hands frequently, wearing face coverings as much as possible, because that will help protect us for the unknown with regards to that. So it's essential that we don't let our guard down, especially with the months coming up, and we keep moving forward in that positive direction, because it's how we impact one another. We have schools that are trying to get back in session. School District 186, they want to bring the children back safely. And, people look at just the teachers and just the administrators and just the students, but really it's the family makeup. If you're going out at nighttime, or if you are going to work, you have to take precautionary measures, because when you come back into the household, it's very easy for you to catch the virus and pass that along. So it's crucial that we all be cognizant and be vigilant with regards to those healthcare parameters to stop the spread of the coronavirus. And schools can get back in session, and people can interact on a more frequent basis, more enriching basis that we all want to enjoy. With regards to that, the one last item I will announce is the census has been extended to the end of October. So if you have not done so, it is crucial that you go to 2020census.gov and fill out the census form, because for every person that does that, that means $1,400 coming back to our community. That's what the average is per person. So if you calculate that out over a 10-year period, which would be the next census, that's $14,000. And then you just multiply that out, and it just really escalates the importance of filling out the census, not only from dollars coming back to our community from the federal government support, but also support in Washington. You know, we'll be redistricting for our congressional seats, and that's a key component of that. Actually, from the city side, we'll do redistricting of our wards. And so it's important that everybody does register for the census so we get our full representation in Washington, D.C., and then as well as getting our full government reimbursement or support with regards to dollars to our community. So with that, it gives me great pride to introduce our panelists, and we really thank them. We have a second to none medical community. I think the pandemic has really proven that. We can't thank our healthcare providers enough for what they do to putting themselves at risk to taking care of our people. And the great recognition of that was that Springfield, Illinois was voted the #1 place to be post-pandemic. And that's due to a number of things, but #1 is our healthcare providers and what they've been able to do to provide that support. And we're a regional provider of health services. So with that, we do have joining us, and I'll say each one's name and then go back to have you do your own introductions, if you would, please. The first is Dr. Stephen Amaro, and he's with infectious disease from Springfield Clinic. And the next would be Dr. Vidya Sundareshan, and she's the infectious disease specialist with SIU Medicine, but she also is a public health medical advisor for our incident command team. And I was teasing her before he came on that she is the Dr. Fauci of Springfield. So we really appreciate her insight. And then Dr. Gurpreet Mander, he's the Chief Physician Executive with HSHS Illinois. And he also serves on our medical district as my appointment to the medical district, as well as serving on the governor's broadband initiative. And then we have Gina Carnduff, from Director of Infectious Prevention with Memorial Health Systems. And one unique factor with regards to, we have great healthcare, it goes without saying, but Memorial Health Services, what a lot of people probably don't realize, they received an award that's given nationally, and they were #1 with regards to that. And they competed on the global market, and they were #2 on how they provide patient care to the individuals they're serving. So they're looked at as almost like a model with regards to that. So we appreciate everybody's efforts, and they all specialize in different areas with regards to their entities, and that really makes Springfield a whole and the great community that it is. So with that, Dr. Amaro, if you would share with us a little bit about yourself, we would appreciate it.
Hi, Stephen Amaro. I'm a medical director of infectious disease at the Springfield Clinic and medical director of infection prevention at Memorial Medical Center, in conjunction with one of the best infection preventionists I've ever worked with, who's also on this panel. This is Gina Carnduff. This question that was asked of me is, how are the symptoms of influenza and COVID-19 similar? That actually is a pretty complex question, and it requires some background. The first thing to understand is that they're not the same virus. They're different viruses. Influenza belongs to a group of viruses that are also RNA that are classified as orthomyxoviruses, and COVID, of course, is a coronavirus. The viruses are transmitted in similar ways. So as a consequence of being two different viruses, you can get both. And actually, I did see a patient who had both, who fortunately survived the illness. Patient at that time was at Memorial Medical Center. That patient was 88 years old, and it just taught me that there's a reason people live to be 88 years of age. I was very concerned that she would not make it. But the viruses, in terms of how they interact, are different. Both have caused pandemics, and both have caused severe illness. Influenza is most famous for the pandemic in 1918-19. And at that time, with about a quarter of the US population, it caused 700,000 deaths in the United States. And it was referred to by the people at that time as an illness that could occur its entire course over 12 hours. And they would say, well, it's the only illness where you could have breakfast with your family and dinner with your ancestors. So you can imagine a group of people who are coping with not just that, but tuberculosis and poliomyelitis and influenza, and coping with that without ICUs, ventilators, without antibiotics. And so you see, as a people, we have a strong heritage of having to deal with these sorts of pandemics, and in the history of man under much more severe circumstances. Coronavirus, of course, is also causing a pandemic. It belongs to a family of viruses which have caused a pandemic in 2002 or 2003 called SARS, and more recently, this current COVID-19 pandemic. They differ a bit in terms of their symptoms. Influenza, especially if you're talking about a naive patient, is much more likely to cause acute and severe illness. Especially, it also causes more severe illness in younger people and especially pregnant women. It has a seasonality, unlike coronavirus 19, which appears to occur all throughout the year, and we've demonstrated that. But influenza occurs usually sometime between October 15th and April 15th. So usually around tax time is when it goes away. I usually refer to influenza virus as kind of like an ice storm in Springfield. It kind of knocks down all the weak branches. But it also can cause severe illness in young people and pregnant women. The symptoms of influenza are usually influenza-like symptoms, because they're famous, but they cause rigors, fevers, shaking, and the illness is usually much more acute. Coronavirus, on the other hand, can occur subacutely. While both illnesses can have people who present with few or little symptoms, coronavirus is much more likely to have somebody who's infected with very little symptoms. And if you look back at some of the press conferences that occurred in early May, the governor of the state of New York was talking about their new coronavirus infections. And at that time, New York had the most cases, and so people were paying attention to them. And it turns out that 2/3 of their new cases were people sheltering in their homes. And it happens because the people who were having the infections, who were helping out the people who were in their homes, because no one is an island, were unaware that they were infected and were transmitting the virus into the home environment. Both illnesses cause respiratory illness. Coronavirus almost always causes an interstitial pneumonia if it causes symptoms, whereas influenza virus can cause an inflammation of the bronchi and the trachea, but it also can cause pneumonia. Both illnesses likely have post-illness secondary effects. Most likely for coronavirus, it's going to be scarring in the lungs. For influenza, there's a myriad of effects, including inflammation of the heart, of the brain. You can get inflammation of the muscles, and you can even get Guillain-Barré syndrome from influenza. And there was a study looking at the rate of Guillain-Barré syndrome related to vaccination versus influenza. And it turns out that influenza is much more likely to cause the Guillain-Barré syndrome as a wild illness than is the vaccine. And so that's important to note. The illnesses differ in one very important way, and that is we have a vaccine and we have medications which have been established to treat influenza. And when you come in, and if you get influenza, we can help and we can treat you to make you better. But if you have an age-related immune deficiency or you're over 65, you're at higher risk for morbidity, just as you are with coronavirus. I tell my patients who refuse vaccinations, some of them were activist vaccination refusers, that if they're going to refuse a vaccination, they have the right of free choice, but only to the extent that it is not inconvenience or hurt someone else, just like smoking inside of a restaurant would. So I tell them, if you're going to refuse a vaccine, then you're obligated not to visit your elderly relatives or sick relatives between October 15th and April 15th. Because if you do, you could kill them. So we have a vaccine that can prevent influenza. I can tell you, since both are transmitted in very similar ways, you can get coronavirus infection and you can survive it if you're younger. But if you get both, even if you're younger, I can't tell you that you'll do well. It may be a burden of illness, which kind of is the last straw on the camel's back. And so both illnesses can be transmitted in a similar way, but they're two different viruses, and that's extremely important to understand. In terms of what should you do if you get sick? Well, if you've had a vaccination for influenza, then influenza is likely not the cause. If you have not had a vaccination, then the importance of personal self-triage is an issue. We have many illnesses that circulate in the community that cause common colds that get better in 3 to 5 days. If your symptoms are getting worse, then there are outpatient testing centers. The Springfield Clinic has a drive-through lab. There is a respiratory center that Memorial Medical Center sponsors. And if you're well enough to go through one of those, then they will see you and assess you. What we don't want to do is have you go into a building where there are large numbers of people and be infectious and not have appropriate precautions. We can isolate people who are sick. The important thing about wearing a mask is if you think you're sick and you may have coronavirus or influenza, wearing a mask is critical. The mask protects the people around you. It doesn't protect you. And it protects people around you by catching secretions that come out of your nose and mouth. And if you're coughing or if you're having problems with nasal discharge, it's important to wear the mask both over your nose and your mouth. And it will protect the people around you. If you happen to wear a mask and you're out in the community and somebody comes within 6 feet of you who is not, and you do not understand their exposure history, they put you at risk. And for that reason, you should either walk away or you should advise them that their behavior is not acceptable and putting you at risk, and encourage them to wear a mask. And so in terms of coronavirus, that's the best we have right now. Hopefully we'll have a vaccine in December, January, maybe later. And when we get both vaccines, then within a reasonable period of time after the application of the vaccine, we can get back to where we were in December of 2019.
Well, thank you very much. And yeah, that's a great segue with Dr. Sundareshan with SIU Medicine for a number of reasons. And a lot of people might not realize it's a research school, and as well as educating our future physicians. But if you would give a introduction, we'd appreciate that, but also touch on the importance of getting a flu shot, or, as Dr. Romero alluded to, some people might not want to, and the importance of doing that, whether you're a healthcare provider or any individual, if you would, please. But if you'd introduce yourself as well, we'd appreciate it. And thank you for being here.
Thank you, Mayor, first of all, for having this important conversation and for inviting me to be a part of it. My name is Vidya Sundareshan, and I am with SIU School of Medicine. I am an adult infectious diseases specialist. As an adult infectious diseases specialist, I take care of patients who are admitted to the hospital, as well as in the outpatient clinics, and help them with all sorts of infections. As a faculty in academia with SIU School of Medicine, our mission includes medical education, research, community outreach, and of course, patient care. As a faculty, I help in the training as well as the education of medical students, of residents who are training in the subspecialty of infectious diseases, as well as internal medicine, and then also help train the next generation of infectious diseases specialists for fellows who are with us in infectious diseases at SIU. I'm also a physician scientist. I collaborate with multiple scientists to make sure that we are bringing the best and evidence-based treatment to our practice of medicine here at SIU. Lastly, I also specialize in public health, and I help as a medical advisor to Sangamon County Department of Public Health, and I've done so since 2012. With that, I'd like to say that influenza has the potential to be very serious and can have significant complications in the disease spectrum. We have seen from data from last year that close to 40 million people were infected with the virus. About 400,000 people were admitted to the hospitals. There are about 18 million people that sought help from their physicians for problems related to influenza. And then we've had close to about 20,000 deaths from influenza alone. And this also includes the complications that we see with influenza. So what does a vaccination do to help us prevent this? With vaccines, we have a 40 to 60% potential to reduce the risk of actually getting the virus. There is a 58% risk reduction in hospitalizations. There is a further risk actually for people who are admitted to the hospital from 75 to 85% for people who are admitted to the ICU. So it definitely decreases the severity of the illness in those who are admitted to the hospitals. It is extremely useful for people with comorbidities, people who have heart conditions, people who have COPD, people with advanced age, people with young children. Young children definitely have a higher potential for getting the infection and getting sick as well, and pregnant women. In pregnant women, we have seen that the risk of getting a respiratory illness and the risk of getting admitted to a hospital are reduced tremendously, close to 50% reduction in that as well. And finally, when we get a flu shot, like Dr. Amaro was mentioning earlier, we have the ability and the power to actually protect people around us, people who have vulnerabilities, people who are at risk. With us getting a flu shot, we definitely have a sort of a protection that we can give to the other people. We may be transmitting the virus without our own knowledge. So it's very, very important to get the vaccine to also help protect those around us. And that's an important reason why adults in the workforce, especially if you're in healthcare, it is important to get the flu shot.
Well, thank you very much. And real quick question is there an age limit, or, can you be too young to get one or too old to get one?
So anybody over the age of 6 months is recommended by the Center for Disease Control to be eligible for a flu shot. There are many licensed and age-appropriate vaccines, and one can talk to their providers to see which one would be best suited for them. There's a high-dose vaccine which is recommended for people greater than 65 years, and they need a higher boost to get a good immune response or good antibody response to fight the flu virus. There is an intranasal preparation for people, and this is a live attenuated, which means that the vaccine is not completely killed, but it's weakened, and it's administered as an intranasal vaccine. And people may not want to get a shot and prefer to get an intranasal vaccine instead. So that is also available. And then people who think they may have an egg allergy, this year we also have an egg-free vaccine which can be administered. So anybody over the age of 6 months should get a vaccine, especially if they have comorbidities, heart conditions, lung conditions, pregnancy, young children. They should definitely get the vaccine.
Excellent, thank you. And then next is Dr. Gurpreet Mander, and he's with HSHS. If you would give us an introduction, and also if you could share with us what HSHS is doing to provide care on both sides. We know that the hospital is built out for COVID patients, but just what you've done to do other surgeries, or how do you balance the two of those, and especially when you're trying to provide flu shots as well?
Yeah, thank you,
so
Mayor.
If you give an intro as well. Thank you.
Thank you, and good afternoon. And I appreciate the opportunity of being here, and thank you once again for hosting this this important event. And so, my name is Gurpreet Mander. I'm the Chief Physician Executive for St. John's and the Illinois Division of Hospital Sisters Health System, which encompasses about 9 hospitals across the region. I'm also an associate professor at the SH School of Medicine in Pediatric Intensive Care. I do practice on a part-time basis. I also serve as the executive director of the Illinois Telehealth Network. When this, if you recall, when the pandemic came through initially, we found ourselves in a situation where we were anticipating a surge in cases. So we shut down. And we moved into phase 3 as per the governor's direction therein. And after that, subsequently, based on the numbers, the data, et cetera, we opened up in May 11th. One thing we found over the course of this time was that after we did open up, we found that people were afraid of seeking healthcare. And I think that's an important point, that while we are dealing with COVID, we need to continue to seek routine healthcare. People were afraid of coming to the hospitals, I guess for fear of getting COVID. And we have done everything we can to prevent that from happening. We take care, we take all the precautions as under the guidance of CDC, face masking, screening of our colleagues, patients. And even when we schedule elective surgeries, we follow IDPH guidelines in order to do that safely as such. And I do encourage people that as we kind of go through this pandemic, the one thing you don't want to do is delay your routine healthcare, your screening, procedures like colonoscopies, etc., and also seek healthcare when you need it, because the long-term effects of that can be fairly detrimental therein. We also, have all our employees take flu shots. They are mandated to take flu shots so that we are not getting either infected or transmitting the flu as such. So I think overall we find ourselves in a good situation, as far as providing routine care to patients and also continue to take care of COVID. You might want to recall that given our current numbers in our Sangamo County, the percentage of patients in the hospital who are COVID positive is relatively small as compared to the number of patients we are taking care of for other issues like heart attacks or other situations like obstructive pulmonary disease, or be it routine surgeries. And I do want to emphasize to all our friends out there that you are safe when you come to the hospital, as and when you seek care. Thank you.
Thank you very much. That's good advice and reassuring. I think that's always surprised me when people express nervousness about going to the hospital. I think in general, I think we might get a little nervous, especially about the flu shot. So any words of advice if you are nervous and don't like shots? Any words of advice, Dr. Mander?
No, I'll just reemphasize what my colleagues have already stated. We take all these precautions, including masking, shots, social distancing, not only for ourselves, but for each other. I think if as and when we come out of this pandemic, it'll be as a community. We need to take care of each other and do this for our families and for our friends and for our neighbors therein. So it's a shot. It definitely does, it's a little prick, but it goes a long way in preventing serious illness and disease. So,
if I could add something to that, in the year 1900, the average life expectancy was 35 years. And we had measles, and we had mumps, and we had rubella, and we had diphtheria. And our ancestors would shake in their graves if they realized that some of us are deferring vaccinations. The advances in terms of life expectancy are largely related to advances in antibiotic therapy, which was developed in the 30s and 40s, and the vaccinations, which we have implemented to eradicate diseases, including smallpox, and control diseases like poliomyelitis and measles and mumps and rubella, and influenza, and hopefully coronavirus. And so failure to take part in that great contribution to the health and welfare of the world puts you in the group of people in the 1900 a year.
Yeah, we have to learn from our history without a doubt. And with that, last but not least, Director Gina Carnduff with Memorial Health Services, we appreciate you taking time. If you'd share with us a little bit what you do at Memorial Health Services, and then also, as Dr. Amaro and others pointed out, when we're going into almost like this combo season with flu and COVID, your thoughts on that, and that you'd like to share, and the importance of social distancing or whatever you'd like to share, and reassuring people the best practices as we move forward to this challenging time.
All right, thank you, Mayor. Good afternoon. I will echo as the others, and thank you for this opportunity. This is a really important conversation, and I agree with you that Springfield is very fortunate to have the community of healthcare providers that we do. I'm humbled every day and overwhelmed by the talent that we have in our community. So just a quick background about myself. I am a registered nurse. I am the Director for Infection Prevention for Memorial Health System. I am in my 17th year with Memorial, and my 7th year in infection prevention. I have my master's degree in public health and certification in infection prevention. And what an interesting time to be in infection prevention. So Memorial Health System, we are following all of the regulations and rules and recommendations put forth by Illinois Department of Public Health, Centers for Disease Control, as Dr. Mander spoke to earlier. We're screening all of our visitors, all of our colleagues. And, I look at it as the hospital is actually one of the safest places to go, where we can assure you that everyone is wearing a mask. All of our services are disinfected routinely, as opposed to maybe somewhere in the community where masking is not always perhaps enforced, and maybe things aren't disinfected as they should be. So I am confident that the hospitals are certainly a safe place to go. So as we enter flu season, I think it's important to remember that flu is, the transmission of flu is preventable, also like COVID-19. And if we think about from what we know thus far, COVID-19 is spread primarily from someone who's infected with the illness from close contact with them without the use of masks. And the person that's ill with the virus can spread the virus as they're talking, laughing, singing, in close proximity of one another. And flu is spread the same way. So all these things that we've been talking about throughout this year, such as social distancing, maintaining at least, and I emphasize at least, a safe 6-foot distance between one another, that will help prevent the load of virus that maybe a sick person could be transmitting and prevent you from getting it. Again, why masks are so important. The masks protect everyone else. I think Amaro spoke to this earlier. They're not to protect you. So what we do know is you can actually spread the virus or be most infectious up to 2 days before you show signs and symptoms. We call that the pre-symptomatic phase. And so when you wear a mask, you could be potentially, we call it shedding virus and not be aware of it. So a mask will help cut down on the concentration of the virus being put out into the air. And if we both are wearing a mask and we're keeping our safe distance, that cuts down on that risk. It's also important to remember social distancing as we are moving into the colder months and things are shifting inside. I think it's pretty tempting to be, with friends and family indoors and not wear masks. However, as we come upon the holidays and where we really need to see our loved ones that we haven't seen in a long time, we need to think about the risk and how important it is to maintain that social distance of at least 6 feet and wearing masks, because what may be minor signs and symptoms to someone could be potentially lethal to another. So just always think about it as being aware and protecting those around you. So the social distancing, masks, touched on that. Last but certainly not least, hand washing, hand hygiene. While the CDC has said it's less likely to be transmitted, on services, it still plays a really, really important part, and it can be. So if you touch something dirty and then you touch your eyes, nose, or mouth, that's just another portal of entry for that virus to get into your system and get sick. So that's the same for COVID-19 and flu. Again, these are preventable. So if we follow these everyday actions to prevent illness, we also got to keep in mind we don't want to overwhelm our healthcare systems. We are already struggling caring for the number of COVID-19 patients across the United States, and flu season has not even arrived yet. So it is really important to take all these preventative measures, get your vaccine for flu, because that could make the difference of you staying at home versus a hospitalization. And you're also protecting all of those around you that could potentially get really, really sick from either one of these viral illnesses.
Well, I appreciate that insight, and you speaking to the being with others and distance. Can you speak to the children, especially they're going trick or treating? What would you advise them as they're going out? When I was young, I'd like to go with my friends. I'm sure that's going to be the case this year. What's your advice with regards to best practices if they choose to go out? Some will probably just stay home, but those that may be going out, what's your advice to them?
Sure, and I certainly appreciate it. I have 2 little ones myself who love Halloween. I know it's tempting, and I know this is a time to be with friends, but however, we're in a pandemic, and we need to think about things a little bit differently and err on the side of caution. So if you are going to go out, I always recommend staying with your tight household just to prevent the spread. So if you're going to go out with your immediate family and maintain a safe 6 feet of social distance from others. And I think you touched on this earlier, Mayor. It's still important to wear a mask, and mask doesn't mean Halloween mask that goes over our face. It means a mask that fully covers the nose and mouth to prevent further spread.
Yeah, and with that, the school district 186, especially when they come back in, I think it was about 1,000 school children have not been vaccinated yet. And so Dr. Sean, if you could speak to that, and anybody else that would want to weigh in, but the importance of getting vaccinations up to date because they're not allowed to go back to school unless they have those vaccinations, and then the best way for them to access that care.
Yes, thank you, Mayor. That's really a very important issue. There were a lot of vaccines which could have potentially been delayed when we were in the thick of the pandemic earlier. There are catch-up vaccinations that are available. I know Sangamon County Department of Public Health was continuing to give all the childhood vaccines, even with the pandemic and all the restrictions that we had in place. So it is really, really important to make sure that everybody is up to date with the basic vaccinations that need to be given. Additionally, with flu, this has been alluded to earlier as well. The more people we have vaccinated, the better herd immunity we have. And we're lucky we already have a vaccine for influenza for that. And every year, there are experts that look to make sure that they have a good match with the circulating vaccines. And that's why it's important to get it every year to ensure that you're up to date with whatever's circulating for that time for influenza. So it's very important to have that. If we have 75% to 80% of people immunized with the influenza vaccine, the influenza season is going to be definitely milder. And we're going to see less complications, less hospitalizations, and of course, less deaths.
Well, thank you. And then one thing that anybody else care to weigh in on that? The one thing I grew up in the 60s and 70s. It's a different era. When I was young, if I got sick, my mom would give me St. Joseph's aspirin, send me to school. We didn't have vaccinations as much. We did have measles and smallpox. So Dr. Mander or Dr. Romero, if you'd weigh in on the importance of, if an individual has that type of mindset, how do you get them to get the vaccinations or reassure them that your immune system as you age is not where it needs to be and you need this little help or booster shot, if you will, associated with that?
We administer pneumococcal vaccinations for streptococcus pneumonia at age 65, and don't administer it at 75, 85, or 95 unless there's some exceptional circumstance. The reason for that is the decline in the response to the vaccine. You will see a declination of approximately 20% per decade with people in their 90s functioning at a borderline level of somebody who would have advanced HIV. With the CD4 count, it's a measure of their immunity running around 200. It's called age-related immunodeficiency, and we also see people get other illnesses that when they're younger, they simply wouldn't be bothered by, which is why it's important to get this herd immunity and why we give these patients vaccinations. I previously mentioned somebody who had both influenza and coronavirus. She was 88, but she also had a flu shot, which means she was primed to deal with the influenza, and she survived both because she's 88 years old for a reason, but she also had a little help. Helping our elderly and helping our infirm people means that if you're 15 years old and you're going out for the high school football team, you can still get the flu and transmit it, even though you might have an illness that's acute but gets better quickly. You can transmit it, and you can transmit it to your 75-year-old grandfather who's interested in watching you play football, and he may not make it through the season. So it's important for you to protect other people as well as yourself in this setting.
I think the only thing, Mel, I'd add to that is there's a lot of misinformation out there, especially on the internet around vaccinations, etc. So I would encourage people that should they have any questions, they need to have a conversation with the healthcare provider, the doctors, and kind of go through the thought process and the understanding. That would be helpful.
Yeah, that's a good point because we're in the the age of the internet, and people do go online to see what their symptoms are, things of that nature, do that self-analysis, if you will. But it's always important to consult with the experts with regards to that. So one question that did come in, and whoever would like to weigh in on this, herd community, several of you have mentioned that. Would someone want to give a layman's term that I would be able to understand with regards to what herd immunity means? So Dr. Sundareshan, if you want to weigh in on that.
Yeah, I can definitely start to talk about that. So herd immunity is the basic protection that we have against an infectious disease in the population or in the community. And I have to add, one of the best ways of getting that is vaccination. Natural infection is not a way to acquire herd immunity. It does confer herd immunity. It has done so in the past, but it comes with a lot of complications. It comes with a lot of risk. The safest way to do that is vaccination. So the more people we get vaccinated, and which is what we should attempt to do with influenza, and we should attempt to do with COVID-19 vaccines when they are available, is try to get as many people vaccinated as possible. Because with vaccination, the way people develop immunity is by developing antibodies against a weakened or a dead virus. And they already have these antibodies. And when the body actually encounters the actual virus, they already have the protection. And we are able to gauge that a little bit better because not everybody that gets the virus may present with symptoms. So it's really important to make sure that the antibodies do develop in the right way with vaccination.
Just to add to that, we did have a illness-related herd immunity which developed in 1918-19 with pandemic flu. We did not have a vaccine. And it cost was great in terms of morbidity and death. And about 700,000 people in this country died. The reason herd immunity works is because the virus needs to move from person to person to person to spread immunity. If you have a virus and it bumps into somebody who's got a protein that fights the infection from a vaccine, it can't. It hits a dead end. And the more dead ends we can give in the community for the virus, the more likely we'll be able to get rid of it. If we don't come up with a virus for coronavirus 19, if we continue to shelter, we'll spread that curve out perhaps for 6 or 7 years, but eventually we'll get herd immunity, which is inoculated by the illness itself. Hopefully in January or December, we'll have a vaccine and we can start putting barriers to this thing bouncing from person to person. And that's what herd immunity is.
Well, thank you. That's clears it up for me, and I'm sure the viewers as well. So we appreciate that. And one important aspect, of course, is with our young ones, our children going back to school. And so, Director Carnduff, if you'd like to share your insights, or are your children at school or are they remote? And what's your recommendations for parents that might be a little nervous about their children if they're not in school already, going back to reassure them of the best practices?
Yeah, so my little ones are fully remote, and that's just because one of my little ones is high risk. So the decision was made for us. She's high risk for complications. For them we are fortunate that we had the option. So she is, both of my children are full-time virtual. For those kids returning to school, it can be done safe with appropriate precautions that I discussed earlier. Mask wearing is so important. I know it's a challenge for kids, but just helping them understand. I do with my kids. There's some great resources out there just to help them kind of understand why mask wearing is important. Get them some cool ones that they would, be more prone to wearing. But in hand hygiene, that's so important, and it's habit forming for my kids now. So washing hands, masking, and then just teaching the importance of social distancing. And it's really interesting with my kids. It's been so ingrained in them throughout this whole pandemic that when you're watching shows on TV, it'll be interesting how they point out, ooh, they're too close, or ooh, they don't have masks on. It just, I think kids are a lot more in tune and aware of what's going on than what we give them credit for. So it can be done safely. If you have concerns, reach out to your school administrators, your local health departments. But again, this is all preventable. Just taking those actions every day will help keep everyone safe, of washing your hands, wearing your mask, and watching your social distance.
Yeah, that's, yeah, go ahead.
Yeah, I think what is needed is discipline and a common vision, and a shared vision, should I say, and I think that's extremely important. My own two daughters are remote, but they do participate in some sporting activities. And I do notice that in spite of everyone's best efforts, sometimes masking and social distancing does suffer. So, in healthcare, we kind of tend to be our brother's keeper. For example, if I'm not forget to wash my hands while walking into a room, Dr. Sundareshan, being around, will point out to me, hey, you forgot to do that, so please do that. So I think that sort of discipline and a community effort is needed for us to get through this pandemic. And the more we adhere to it, the less people get infected and the less deaths we have. And I think that's important too. So.
I just wanted to add that, there are very good clear-cut guidelines from Illinois Department of Public Health, from ISB. And I should say the school districts here are really taking a lot of care to go through those very, very carefully. They work closely also with the health department. The health department also wrote a set of guidelines which would be easy to follow. So there are very strict recommendations in place in terms of making sure that somebody that's sick is not in that environment when they're sick. It's very important to keep kids home if they have symptoms which are suggestive of influenza or suggestive of COVID. Sometimes it gets confusing. Symptoms like runny nose or abdominal pain, which are also listed as symptoms of COVID, it gets confusing, but there's help available. You can talk to your healthcare providers. There's the respiratory centers and also the health department with the hotlines. You can talk to them to see what the next steps would be.
Yeah, and Dr. Romero, I think you touched on this, but if you could remind us, is there a distinguishing factor with regards to flu versus COVID that someone should get tested or?
Well, just to kind of summarize, influenza causes much more acute symptoms. It can infect and cause complications in younger people and pregnant women, much more likely to do that than is coronavirus. It can cause severe illness in both. The symptoms of influenza are more acute: muscle aches, shakes, chills, but you can also get an infection that we call subclinical, where you just kind of feel like you have a cold. Coronavirus also can cause a totally asymptomatic illness where you can transmit virus. When coronavirus causes severe illness, it's usually somebody who's immunocompromised or elderly, but not always. Sometimes people have a weakness in their immune system, which is genetically inherited, and you can't detect it and they get sick too. But there is usually a reason that somebody collapses from coronavirus, and it usually relates to age-related immunodeficiency or some either medication-induced or illness-acquired defect in immune response. The other thing that I want to point out, is important is if somebody should come up to you and ask you to wear a mask or wash your hands, the correct response is thank you. The incorrect response is to be confrontational. So
that's a good point on the symptom side. When in doubt, check it out. Consult your healthcare provider. I think everybody we try to preach respect for one another, and when someone asks you to keep your distance or wear a mask, it's just so keep everybody protected and safe. But before we wrap it up with closing comments, since we're in this, we're starting Facebook Live now. We're doing a lot of things through technology. I'll start with Dr. Mander, and I'd ask each person to weigh in on the importance of technology, how you've moved or expedited services to the technological phase during this pandemic. And I'll start with Dr. Mander, since he's on the governor's broadband initiative. If you would talk about HSHS and how you put things in place that weren't here prior to the pandemic or, moved in that direction.
Yeah, sure. I mean, very briefly, like when the pandemic started, we moved very quickly and swiftly with our clinics and our practice, and especially practices offering visits to telehealth, telemedicine, because some of the rules had been relaxed and you could use a non-HIPAA compliant platforms, which were easier to install in a short period of time. Even within the hospitals as such, we've used subspecialty consultations remotely. We've also used technology to decrease face-to-face interaction between specialists and patients who may be COVID positive. For example, and then in situations, for example, a social worker needs to talk to a patient who's COVID positive. There's no need for them to go in. You can facilitate that through technology. So we have leveraged that, across the state and all our hospitals, and are continuing to now adapt that to a more kind of sustainable kind of model over time.
Great. And then Dr. Sundareshan. you'd like to explain how SIU's taking advantage of technology through this?
Yeah, I'd like to start off by saying I'm really amazed at the ease and the speed at which we were able to transition when we really needed to see patients over WebEx or by phone. So we were able to do that very smoothly. And, even moving forward, I do see, like Dr. Mander mentioned, I do see a role for telemedicine. It is definitely helpful for a lot of patients who have to travel long distances. They're able to connect with their providers in a safe and confidential manner, and are able to make use of talking to them and getting counseling and advice from them via telemedicine. So a lot can be achieved through that, and it does come with some downsides, like we were talking earlier. Not every place has good internet connection, so the calls drop a lot. So those things need to be definitely improved. But this has a lot of benefits. At SIU, in March, we had almost all patients be seen via telemedicine, and now we have a good mix of telemedicine as well as in-person visits.
And Director Carnduff, you'd like to talk briefly about Memorial Health Services and steps you've taken to move to the telehealth during the pandemic?
Yes, thank you. Similar to the other two, it was pretty amazing how quickly everyone adapted this technology. And I really think it's important to remember that how this is spread. And we really want those who are sick to stay home if they're able to stay home. And this just helps emphasize that, and another infection prevention measure. And I think another side of this is also patients actually may be more willing to seek care if they're able to do it out of the comfort of their own home. Just speaking from personal experience, my spouse otherwise probably would not have gone to the doctor unless I made him, but we were able to use the telehealth app on the phone, able to do in the comfort of our own home, and he was able to get the service quickly. So yes, throughout this pandemic, help prevent the spread, but there's certainly a role for telehealth. And as Dr. Mander spoke to earlier, if it's one thing, one benefit that's come from this pandemic, it's certainly the technology that we have to better serve the patients in our community.
Well, thank you. And then Dr. Amaro, if you'd share with us how Springfield clinics moved in that direction. And then also if you'd want to wrap it up with any closing comments, and then we'll just go in reverse order as we wrap things up. So thank you for being here. Appreciate it.
With Springfield Clinic, and actually with most of the healthcare agencies, there's an issue with regard to fear of infection. People ask me if I'm afraid of coronavirus, and my response is I'm not afraid of it. I respect it. Fear results in sometimes you forget and you make foolish decisions. Respect means you remember. And so telehealth has helped, but also these virtual meetings help to convince providers and patients alike that it's safe to come into the healthcare system. Beyond that, I have to go back to the last great pandemic, which I had to go through, which was HIV and AIDS in the 1980s. Tremendous advances in virology, understanding that there is a retrovirus, understanding how to sequence viruses, understanding how to design medications based upon crystallography that's with computer modeling. And the reason that we have optimism about a vaccine is this virus, coronavirus 19, is rich in proteoglycans on its surface membrane, which provide prime targets for proteins that people can make to fight the infection. And we know they develop this naturally. And with the technology developed through the HIV, AIDS, and in the last 20 years in molecular virology, we will conquer this.
Mm-hmm. Well, thank you for being here. We really appreciate you taking the time and sharing your insights. Then Dr. Sundareshan, you'd like to have any closing comments, and thank you for participating.
Thank you, Mayor, again. And this is really an important conversation. So thank you for taking the time to invite me and weigh in. I would also like to echo what Dr. Amaro said. This is not something that's permanent. It is going to take time. And we really have to make sure that we do what is needed at that particular time to help us get closer to that end. So, at this time, we need to make sure that we continue to follow our 3 Ws: wear a mask, wash your hands, watch your distance, And definitely, I'm going to add a V to that, get your vaccine. Get your vaccine for influenza, and when the vaccine for COVID-19 is available, we should definitely get that as well. That would help, again, like we spoke about, build herd immunity in a safe way and help us get closer to the end of this pandemic faster. We have 11 contenders for the COVID vaccine, and in a matter of 9 months, this has never happened before. So, we definitely need to be very proud of the advances that have occurred, and participate by making sure that we do take the vaccine and follow all the guidelines.
I love that. Wear a mask, wash hands, watch your distance in the vaccine. Very good. Thank you. Thank you for being here. Dr. Mander, any closing comments?
Yeah,
and
thanks
for being here.
Yeah, 1 second, I think. No, I appreciate you having me on today, and I appreciate the input from the rest of my colleagues. I would just echo everyone else's point. I think never, I think in history have we been so dependent on each other as we are today in preventing this disease. And I think that's important to understand, because we do the W's and we, as Dr. Sundareshan said, for each other. And I think if we do that, we'll come out of it stronger. I also believe that this is not permanent. It will pass. We have the vaccines in play right now. Hopefully they will be developed, they will be disseminated earlier next year. And I think at the end of the day, you should not be scared of the disease. You need to be smart, as Dr. Amaro was saying. And I think we will be in a good place in a matter of time. Thank you.
Well, thank you, Dr. Mander. We really appreciate your insights and sharing those with us today. And then Director Carnduff.
All right.
Closing comments. Thank you for being here.
Yeah, no, thank you again for the opportunity for this important message. Again, echoing what everyone says, my call to action really is for everyone. Let's all do our part in getting this pandemic to end as quickly as possible. And so what are your responsibilities in that? To wear your mask, again, not for yourself, but to protect those around you. Watch your distance, stay social distancing. We covered that. Wash your hands, and of course, the V, the vaccination. Please do your part. Again, it's important to think about those around you, your community, your hospitals, your healthcare providers that are caring for those who do get sick. And we all need to hold each other accountable to do our part in preventing the spread of this disease. And thank you again for this opportunity.
Well, thank you. And I think today's session shows why we're where we're at, especially being engaged by Business Insider, being the #1 post-pandemic city. And that's due to our healthcare providers. We had great leader panelists. I thank each and every one of you for participating. And that shows our greatest asset is our people. That's where we are able to progress. And really, when we started this back in March, I remember the hospitals building out, Springfield Clinic, everybody preparing for the worst, hoping for the best. And so far, we've fared very well. We need to continue that, as all the panelists have shared with us, the importance of respecting one another, doing what we can as individuals, not only protect ourselves, protect our loved ones, protect our neighbors, because the important thing is to make sure that we keep moving in a positive direction to support our economy. As we found out this past week, everybody can be hospitalized, all the way up to the president, all the way down to the ordinary citizen. So what we do not want is a run on our hospitals, because that will set us back. That's when the governor will have to make a decision that we do not want to go backwards. So we want to continue our efforts going forward, keep the economy open. And as a reminder, when I did the State of the City just a couple of weeks ago, what I challenge everybody to do is, when you go out, of course, shop local, because you are impacting our neighbors. You're helping them with their jobs. You're helping provide services for you, because we do get sales tax revenue from that to provide police, fire protection, public works. But the other side of it is, if you would go out and when you visit the stores or restaurants, of course, wear your mask. Keep your social distance, do it responsibly. You can do that. But most importantly, when you do go out for our restaurants, buy one up is what I call it each week. If you go out once a week, try to go out twice a week. That way our restaurants can make it through the winter. We're not equipped with our weather to have outdoor dining. So that's the importance of doing what we can to do carry out as much as possible to support our local establishments so we can continue to enjoy the flavors and the businesses that really make Springfield great. So as we move forward, as the challenge to each and every one of us, as I always said from day one, let's make today better than yesterday and tomorrow better than today. And we really appreciate our panelists for sharing their insights so we can make tomorrow better than today. So be careful, respect one another, be kind, and enjoy life and your loved ones. Thank you for joining us. Hopefully you'll join us next week, Wednesday, for Facebook Live.
Thank you.
Thank you.